Good morning. My name is Kevin Wright. I'm an oral surgeon in Castle Rock, Colorado, with Amos Oral Surgery, and I work closely with Dr. John and Dr. Jeremy and Dr. Austin at Clocktower Family Dentistry. I want to take a moment to describe the relationship between a specialist and general dentistry practice, and how the collaboration between specialists and general practice can come together to improve patient care. We spend a lot of time working to meet the patient where they're at. And so there are certain times where patients are driven toward a particular treatment if that office is set up where that's what their goal is, to get patients into that type of care. And we don't want to treat a patient as if they're a nail and we have a hammer as a treatment, and that every patient gets that same type of treatment, and we just fit them in as a cog in the system. Patients are individuals and they deserve individualized care. So between Dr. Carden and myself, we take a lot of pride in meeting the patient where they're at and showing them all of their options, going through, and explaining to them what issues they need to have addressed, what options are out there to address those issues, and then leading them through a discussion where they make the decision themselves as to what is best for them, obviously with our input to give them the pros and cons of each type of treatment. As oral surgeons, we spend a lot of time learning and training on more complex surgical care. And when you get into the world of dental implants, you get into situations where not every patient is the same. You may have different amounts of bone. You may require bone grafting. You may to rebuild the bone that their body didn't grow. They may have had bone loss from previous dental infections that create a more complex situation where a specialty type care is required. The great thing about working with a practice like Clocktower is they help identify those problems to begin with, and are very good about knowing what they are capable of doing, and they know what I am capable of doing. And we spend a lot of time in discussions with each other as doctors to know what individual needs I'm better at handling versus them. So yes, it is a referral-based system where Dr. Clocktower may see a patient, and it might have even been a patient they've had in their practice for quite some time. And patients evolve over time where, they've been maintaining teeth with, cleanings, periodontal care, which is care for the gums. And they start to kind of plant seeds. Hey, we're heading in this type of direction where you may begin to lose some teeth over time. And at a certain point, it's going to need to become a surgical case. And the benefit of having a care team like we have established here is that I bring a lot of different experiences and training to the group versus what they bring their own. Dr. Carden and Clocktower bring their own experiences and training to the group, and my training is different than theirs, and both of those are extremely valuable. I can't do what they do, and I absolutely require their expertise to provide the best care, and I think I have that goes both directions. So by having a care team, we're able to collaborate, bring our differing viewpoints together in an open discussion, and come up with a treatment plan that truly is tailored to that patient's needs. A very hot topic in dentistry today is full mouth replacement of teeth using dental implants. And you'll see this advertised as all on 4, all on 6 teeth in a day. And what that's referring to is for a patient who requires the removal of all of their teeth. And that can be for a number of reasons. It can be from gum disease, bone loss around the teeth. It could be from trauma, car accidents and things like that. Especially in Colorado, you get a lot of people who are mountain bikers who, unfortunately have an accident that harms their teeth. They may end up needing removal of their teeth for a variety of reasons. But Once we've determined that a patient does require removal of their teeth, there are a number of options out there for replacement of them. Traditionally, that's included dentures, and dentures are a removable option. Those can be used with or without implants. And without implants, dentures tend to move around a little bit. And if they get slightly off, out of position, and you bite down, it can pinch and hurt, and it limits how much a patient can chew food-wise. They can't eat a steak with a denture, for example. Dental implants have been around for 30 to 40 years now at this point, and they've come a long way. The technology is really fascinating how a body can take something that's man-made and foreign and accept it as natural. And once we've figured out how to use an implant and get it to integrate to the patient or be accepted into the patient, then we can utilize those implants in different ways. You can create a removable denture that snaps on to the implants and helps retain it in position, but it still comes in and out of the patient's mouth. And that's a vast improvement over regular dentures. But truly the best that dentistry has to offer today are a set of teeth, a full set of teeth that are permanently attached or screwed on to those implants. And that's what you see advertised as teeth in a day, or all on 4, all on X. It's called that because you're utilizing between 4 and 6 implants to hold all of the teeth. So all the teeth are on either 4 or 6 implants. So there is a lot of benefits to a fixed, not removable type of restoration for people's teeth. In the cases that we've done with Dr. John and Jeremy and myself, it's fascinating to see a patient come in and go from, they may have a little bit lower self-image of themselves or self-esteem. They come in not smiling. They kind of have a kind of slightly more downward posture. And as we go through the treatment and they start to see the results come through, you can see them open up and you see their personalities begin to come out. They become more outgoing. You see them smile more often, and their health improves because they're starting to eat a more balanced diet. They're getting a higher protein diet because they can eat whatever they want and be able to chew it properly. There's even some newer studies saying that there are mental cognitive benefits to it as well. So to be able to offer a patient something that can truly turn their life around, not just from a health and oral health, but mental health, whole body health standpoint, and then emotionally to see them come out of their shell is really fascinating. Oh, it's great. There are certain things about oral surgery that can be tough sometimes. You have insurance companies to deal with, and you have cost, changes in costs for your supplies and things. And those can, if you don't focus on the wins, that stuff can be difficult to work through. And those wins are massive. That is really what continues to make us want to learn more about the procedure, continue to invest in the technologies that we utilize. And it is truly one of the best things about what we do.